Thanks.
Okay, so over to you, Vanessa.
Thank you. I'm going to share my screen here for you folks. Perfect. Okay, I think we can see that. Yeah. So thanks everyone for joining us today. My name is Vanessa McConnell. I'm the Manager of Counseling Services at Catholic Family Service and kind of oversee the Rapid Access Counseling Program. We're really excited to share with you a little bit about RAC, as we call it, and the supports it provides. I'm going to just give a little kind of overview of what exactly is rapid access counseling. And so there's really two program pillars that are key to our rapid access counseling service. One is timely access, so making sure families can have the right conversation at the right time, and really about meeting them when they're ready to take action. The second pillar is having changed focus conversations. So it's a single session approach to counseling, and it's kind of unique in the sense that it's really solution and present oriented. And so the difference between single session models in counseling and ongoing models of counseling is we don't really go into all the historical stuff. We really start from where are you today and where would you like to be by the end of this session. And so it's a really goal-based approach, and always just focused on being kind of solution oriented and allowing the family to walk away with some really tangible next steps for whatever challenge they're currently facing. So why single session? We really feel that single session fits in on the continuum of counseling services. So there's certainly challenges and issues that families face where ongoing models of counseling might be the better fit for them. But RAC kind of fills a unique gap in the counseling spectrum that supports families in getting their needs met in different ways. And so actually research tells us that the modal number of counseling sessions that are accessed by folks is actually 1. And so we know we have to have the most impact we can in that first session. And so for us, that's really about taking that very solution-oriented and present-focused approach. So we really try to capture families when they're motivated instead of putting them on a wait list. And so, you know, a lot of folks, and we know resources are tight. And so when you're reaching out for ongoing service, sometimes you're faced with lengthy wait lists. So rapid access counseling is really about catching them when they're ready to take action, being able to support them in those moments when they're ready to take those next steps. And so typically we're able to provide a session for the family within a week of them reaching out to us, if not oftentimes within 48 hours. And so we really try to support families when they're ready and when they've kind of taken that vulnerable first step of reaching out to us. So it's a 75-minute appointment, and it's really tailored and structured to help families gain direction or feel as though they have tangible next steps with whatever issue that they might be facing. And so RAC can certainly support with crisis management because we are very timely. So if a family is in crisis, you know, we can get them seen quite quickly and try to stabilize the situation for them, but also can be really great with ongoing challenges. And so, you know, supporting families in finding direction or next steps with something that might be a longer standing issue in their family. So who does RAC support? So through the Family Resource Networks, our clinicians are happy to support any caregiver who's parenting a child under the age of 18 or any in-child youth themselves from age 6 to 18. So we see lots of different folks in our service. So caregivers we can see for their own individual needs, whether it's a mental health challenge, whether it's relationship issues in the family, couples issues. We're happy to support any kind of adult who's parenting someone under the age of 18, or any youth or child from age 6 to 18 who might benefit from the session as well. And so when we're seeing children and youth, we typically do it alongside their parents and kind of do a family session for those younger folks. And really, we often get questions around what kind of issues can I refer to RAC, what sort of presenting concerns lend well to a single session model. Any counseling need that a family has, we can certainly work with. So we see lots of referrals for mental health challenges, behavioral issues, relationship concerns, whether it's relationship between child and parent or within parents, parenting concerns, parenting strategies, grief and loss, stress management, really anything folks can think about in terms of what they would see as a traditional counseling challenge.
Vanessa?
Can see slides?
Sorry, yeah, we can't see the slides. Well, we can see them, but they're not going from the first over on to
this. Okay, sorry about that, folks. I was like, I'm seeing lots of chats pop up. Perfect. So, yeah, really any kind of counseling related issue we're happy to support with. And again, it might just be about supporting the family and finding next steps with that challenge, or many folks come to us and find that one session was adequate for them and they were able to sort of build that capacity within the session and move through on their own beyond that. So particularly with our FRN referrals, where we're seeing a lot of families families and kiddos, we really focus on promoting resiliency in the family through creating capacity and strengthening relationships. So we welcome to see families all together and kind of work on how do we include the entire network in whatever those next steps with the challenge are. So we really have a lens of strengthening relationships and promoting resiliency within the family in all of our RAC sessions, particularly those supporting the FRN families. Lots of frequently asked questions come up for the RAC model and for single session counseling. We often get families saying, is one session going to be enough? I can't possibly resolve, my problems are so huge, I can't possibly resolve them in one session. And like I said, we really see RAC as fitting a continuum of counseling. And so sometimes we have a RAC session where we'll refer to a more ongoing service where some of that kind of historical work might really benefit the family. But lots of families come to us and are surprised that one session is enough for them. And they walk away with some really great next steps for their challenge. People ask all the time, can I book more than one appointment? We welcome families to book more than one appointment. And so we trust that our clients are going to use the service the way that they need to. So anytime a family would benefit from a really change focused, solution oriented conversation, we welcome them to come back and have another RAC session. We don't put any restrictions on how often they can come or how they use the service. And you can book with the same person from session to session. And so families really like that flexibility too. What I will say is when you book multiple sessions, it's always that same approach. And so clients know what to expect when they come to our service. So it's really starting from where are you at today and where do you want to be by the end of the session? And again, that really present focused approach. And so folks can use it as often as they like, just knowing that that's the model of counseling that they're going to receive when they come to RAC versus what some more ongoing models might look like. We get lots of questions around how long am I going to wait to get my session. So like I mentioned, we typically can support folks we can always support within the week, and typically within 48 hours, we can land families with a session. So when we get referrals from our FRM partners, we have a counselor reach out to that family within 24 hours and set up a session with them. We also have direct online booking through the community as well, where folks can go to our website and book into a session themselves. With the FRNs, we do, like I mentioned, we see a lot of children and families together. We get questions around if I have someone under the age of 18 or attending, what does that process look like? So we do require consents to support kiddos under the age of 18. But our counselors, as soon as we kind of know that that's who they want to attend the session, our counselor will work with the family to make sure we get all the consents from any guardian we need that from. And we'll kind of take the responsibility of making sure those pieces are all in place so that kiddos can be seen. How to access RAC. So we're very excited that the Rapid Access Counseling Program is attached to all 10 FRNs in the Calgary area, as well as the Okotoks FRN. So every hub partner has a direct contact to the RAC program and can directly refer clients to Rapid Access. We also have community offerings available, and in our community programs, we serve absolutely everybody. We welcome everybody coming into the service. And like I mentioned, we have direct online booking for that community services. So the website is there, communityconnectyyc.ca, and select Rapid Access Counseling, and a whole calendar populates where clients are able to book into a time that works for them. I think that is my pitch on RAC. Does anybody have any questions about RAC that I didn't cover?
I have a quick question, sorry. I am here through Bow West Community Resource Center. I'm their practicum student, just taking some notes. And I'm just curious to see and understand like what your response has been since COVID in terms of your program.
Yeah, that's such a great question. So pretty much since the middle of March, we pivoted to full virtual service delivery. And we're currently still doing everything virtually. So we're happy to support clients in accessing their services through video platforms. If video or technology is a challenge for folks, we'll explore phone options for them. So we never want technology to be a barrier to access, although we always try to do everything by video. We feel it's the most effective approach when we can't do in person. So we work really hard with all of our clients to try to make the technology work for them. And if we can't, we certainly don't want that to be a reason not to access support. So we'll connect with folks by phone. And we've been very busy in the RAC program since the pandemic hit. So I think we saw an initial kind of drop off, but we've been very busy ever since, kind of halfway, probably since about May, we've been back up to our normal pace, if not faster. And we're serving folks in all across the province because of the virtual delivery. So we're actually able to support folks in rural communities or people who otherwise would have challenges in accessing service because they couldn't come into the office. So we're happy to support all across the province. With the FRNs, we're just attached to the 10 areas that I listed, 9 in the city plus Okotoks, but the general program through the community referral process can support the entire province.
Perfect. Thank you very much.
Vanessa, I don't know if you're reading the chats, but there was a question asking what the experience and qualifications of your counselors are.
Yeah, that's a great question. So our counselors are all master's level of some form. So we have certified counselors on the team, we have master's level social workers, we have provisional psychologists, and we have fully registered psychologists, both at master's and PhD level. We also have master's level practicum students who support the program during kind of the school year. And so you might get any one of those counselors when you access RAC. If there's a family who has a particular preference or request for a counselor, we're certainly happy to accommodate that. And so in the referral, you can let us know and we can land them with a designation that they feel most comfortable with. We definitely encourage all of our folks are very skilled and very talented counselors. But if a family does have a particular need around that, we're happy to support it. With the FRN service, and so with anything that comes through the Family Resource Networks, we don't charge any kind of fee for the session. With some of our regular community offerings, we charge an affordable fee, so folks can pay what is manageable for them, and we'll connect them if they have insurance coverage to ensure they're with a counseling professional that meets their benefit coverage as well. So we really try to put as much choice in the hands of clients, you know, in making the decisions that feel right for them. Any other questions for me?
Thank you very much, Vanessa.
Thank you.